I'm going to answer 3 questions today. Number 1, what is your bread and butter procedure that you do? Number 2, what's your favorite part about this procedure? And number 3, what's your least favorite? No, let's switch it. Number 1 should be what's your bread and butter procedure. Number 2 is going to be what's your least favorite part. And then number 3 will be what's your favorite part. I like that better. My bread and butter procedure is kind of a combination of procedures, and that is radiofrequency skin tightening, energy-based skin tightening of the lower face and neck, combined with buccal fat pad removal. So kind of a facial contouring procedure. It's not the operation that I perform most often. It's not necessarily my favorite operation, but it is my bread and butter. Okay, now that we got that off the table, let's talk a little bit more about it. What is your least favorite part about it? Why is it in your favorite operation? So, non-excisional skin tightening relies on energy to heat up skin, and it relies on your body's own healing mechanisms to deposit collagen that will then, in turn, lead to collagen remodeling and tightening. I pair that with liposuction, which I do have some direct control over, and buccal fat pad removal to not only slenderize the face, but to help define a jawline and to create shadows where shadows look good, like from here to here. What's my least favorite aspect of this operation? It's the fact that I don't have as much control. Just like my patients, I am relying on technology that is developed and optimized by a third party to safely transmit energy to deeper levels of the skin to allow for collagen remodeling and tightening. The fact that I have less control over it is a huge plus in that there's not many scars to show for it, but I can only do so much in terms of being a control freak. What are the benefits of this procedure? The benefits are so many that it is definitely my bread and butter or go-to facial slimming procedure in people who are not ready for a facelift. Namely, number 1, minimal downtime. Number 2, minimal risk. And number 3, predictably solid results in patients who are good candidates for this procedure. Check out what this entails. One of the best things about being known for and doing a lot of wide awake surgery is the ability to interact with my pleasant team and my patient on a very unique basis. And it's a great opportunity, believe it or not, to get to know somebody almost like we're doing a facial or a haircut. The art of awake surgery involves slowly but surely numbing somebody insofar as they don't really feel it. And something that looks really unpleasant on camera is very, very well tolerated by the patient. Almost like you've had a few glasses of wine or something like that. People really even surprise me as to how much they can tolerate. And radiofrequency skin tightening in particular is pleasant because you can see, you can hear, you can feel the effect of this probe. You don't have to assume that, for example, you're chilling tissue and that cells are gonna be lost. You can actually measure temperatures in real time. You can see heat with a FLIR camera, and you can even feel the heat with your hand. When the fat is ultimately suctioned out after heating it, you can see that there's a difference of that fat versus areas that are liposuctioned by more traditional measures. The experience itself is very relaxing. It's almost cathartic. It's very gratifying to uniformly heat up a block of tissue and to carry on a conversation with your patient. I'm very blessed to be known for this and to be able to offer it to so many people because it really is a truly positive experience for me, for my staff, and for my patient. After approximately 100 to 150 cases, I become very well attuned to what parts of the procedure patients can sense and what parts they can't. And things that look awfully gory to patients are truly not even felt by my patients. I've done facelifts and people have said, wait, have you actually started already? So what looks unpleasant, you have to take my word for it, is actually a very pleasant experience. And there are some things that I do awake and I know that patients are going to feel. For example, when I take out the buccal fat pad, patients do feel in their temples towards the end, they feel a sense of pulling, and that's pretty common. But with the FaceTite procedure, or the radiofrequency skin tightening procedure, I mean, there comes a point in the case where patients just mellow out to the point where they can't feel anything, and there's no anxiety or angst associated with it. And the beauty of the procedure is I can sit here and I can watch the patient slowly but surely get slimmer and more slender, and I have direct control over the areas that I'm trying to defat and slenderize. There's a real art, a real sculpture to this combination of procedures that I'm grateful to be known for, because it's fun to perform this operation. And every patient who comes through my door gets to experience a more veteran version of me. And it becomes, even more of a challenge each time as I get better and better and better. So 250 cases under my belt have put me in a position where I feel very comfortable saying that radiofrequency skin tightening and buccal fat pad removal, this combination in particular, would qualify as my bread and butter.